What CPT codes apply to telehealth services? Imagine trying to get medical care without leaving your home. Telehealth makes that possible, but how do doctors bill for these services? That's where CPT codes come in. CPT codes, or current procedural terminology codes, are used by healthcare providers to describe the services they give. For telehealth, certain codes are used to show the type of visit or service provided remotely. In 2025, most telehealth billing still relies on traditional evaluation and management codes, which range from 99,200 to 99,215. These codes cover different levels of patient visits, from simple check-ins to complex evaluations. When billing for a telehealth visit using these codes, providers often add a modifier called 95. This modifier indicates the service was delivered via real-time audio and video. Depending on the payer, the place of service code also matters. For example, code 11 is used for office visits, while code 2 is for telehealth services provided outside the patient's home. If the patient is at home during the visit, code 10 might be used. These codes help insurance companies understand where and how the service was delivered. In addition to the traditional codes, the 2025 CPT manual introduced new codes in the 98,000 series. These are specifically for telehealth services, including audio-only visits and mental health teletherapy. These codes help better capture the nuances of remote care, especially for patients who cannot access video technology. However, Medicare, the main federal insurer, still mostly requires the use of the traditional evaluation and management codes for billing telehealth visits. Remote patient monitoring is another growing area. Codes like 97,550, 97,551, and 97,552 are used to bill for devices that track patient health data from afar. These are now included in the Medicare telehealth services list for 2025. For mental health services delivered remotely, providers can use either the new 98,000 series codes or the existing evaluation and management codes, depending on the service. Virtual check-ins, which are quick, brief conversations initiated by the patient, are billed with code 90,016. This replaces the older code G2012 and is used for established patients to avoid unnecessary office visits. Modifiers and place of service codes are key to correct billing. Modifier 95 shows the service was synchronous telehealth, while place of service 10 indicates the patient was at home. Using the right combination ensures proper reimbursement and compliance with insurance rules. When setting up telehealth appointments, providers should always verify what codes and modifiers their payers requiring. Each insurance plan might have specific rules, and state laws can also influence billing. Accurate coding helps ensure providers get paid fairly for their services. In summary, billing for telehealth in 2025 mainly involves traditional evaluation and management codes with telehealth modifiers and place of service codes. The new 98,000 series codes expand options for audio-only and mental health visits. Staying updated on payer policies and using the correct codes is essential for smooth reimbursement and continued access to remote care.